Hi, my name is Jess Russell, and I am the Chief Operating Officer at SummitStone Health Partners. And I will be chatting with you all today about 5 top reasons that you should consider a career in behavioral health. So the first is really that psychology as a whole is a very young field with endless possibilities. If you see yourself as a risk taker and a person that likes to ask why, then I would say let your curiosity move you forward into this field as the opportunities are truly endless, whether that is in reference to any knowledge that we are uncovering regarding brain development or actually impacting the lives of others. Secondly, I would say flexibility. So my educational journey really began with an undergraduate degree in business, and I quickly found myself traveling a lot. And I knew that my ultimate path forward would be to have a family someday. And I decided that I needed to revisit my morals and kind of what life looked like ahead. And so I started to look into master's programs and realized that the behavioral health field really allowed for some substantial possibilities related to flexibility. Some of those could be just the core work week, which could be 4 10-hour shifts, even working at nights or part-time. But I really took that into consideration in terms of my longer career goals. And then there's process improvement, which probably isn't something that you hear about from other folks in the behavioral health field. But I find myself to be pretty competitive. So if you're an athlete or somebody that just is competitive and likes to play games, maybe with their family, think about how that can come to the table in your career. In behavioral health, there are a multitude of opportunities to make improvements in the lives of others, as well as your existing environment in which you work. So if you're striving to be the best at whatever it is, then I would ask you to, again, consider behavioral health as a field that you may be able to make a significant impact in. One of the things I think about when it comes to process improvement and being competitive is that in administration versus being a clinician, we have the opportunity to strive to provide the best clinical services, but also really from an ethics standpoint, provide the best level of care and continuum of care. And so sometimes our day in and day out in administration may look like working with different funding sources or state officials, even quality, including chart audits could be a part of that. So that's a really exciting part about behavioral health. And then there's always meaning. So, when you work in this field, there's a lot of us that have big hearts. And I would say a deeper meaning in giving back is part of who most of us are at the core. And that's really a part of my day in and day out at SummitStone and being in a behavioral health position, again, whether that's being a clinician or administration. If you volunteer anywhere right now, I challenge you to think about the real sense that drives you within. The difference, though, with working in behavioral health is there's that deeper meaning that's also, yes, you receive a paycheck. And so I would say while you're considering a career path forward, think about if deeper meaning is a part of what matters to you in a career. And if so, wouldn't it feel good to receive a paycheck as well? Because that's something that you're striving to move forward and help others, as well as actually going home and feeling like you did a great job. And last but not least, I would say passion. So no matter what you do, I urge you to have passion drive you forward in your career. For me, in behavioral health, working in this field, I really was interested in helping in the field of addictions, specifically because of my own life experiences and things I had witnessed, really even at other careers. Ultimately, your career path should lead you back to anything that you're passionate about. And working in behavioral health allows you to help individuals be their best self, but also allows yourself to go home at night and feel really good about the day that you just had and the contributions you've made. So to conclude, I would ask you to think about the following. Do you want to work in an evolving field? Does flexibility matter to you in your career? Are you competitive and driven to improve your working environments and the lives of others? What deeper meaning do you need outside of a paycheck in order to feel fulfilled? And how do you show up at work passionately? If you feel excited by these 5 questions, then consider the field of behavioral health.